Hello, my name is Daylina Rex. I am very happy to be here sharing my briefing regarding the drug marijuana. Here is an overview of my presentation. I will discuss the drug marijuana, the neurobiology and mechanism of action within the body and the brain. I will also discuss the impact on individuals, both long-term and short-term effects, as well as medical advantages. And lastly, I will discuss the drug's impact on society. I will introduce a timeline from origin to the public opinion currently. Marijuana is one of the oldest crops known to man and the most popular choice of drugs today. Marijuana is made from the Cannabis sativa hemp plant and is known by many names: 420, blunt, bud, doobie, dope, grass, green, joint, weed, pot, Mary Jane, and many others. Marijuana is smoked, vaped, eaten, mixed in with food or tea, and sometimes combined with other drugs. Cannabis products are everywhere, used both recreational and for medicinal purposes. Mostly for relaxation, pain, anxiety, insomnia, and behavioral therapies. Common effects of this drug are euphoria, relaxation, an altered perception of time, increased appetite, heightened sensory perception, and adverse effects are fear, distrust, panic, anxiety, and psychotic symptoms. Marijuana dates back to 2900 BC and was mostly used for medicinal purposes in teas. The Cannabis sativa plant contains approximately 400 chemical compounds, of which 100 are phytocannabinoids. There are two elements, THC and CBD. The THC compound is what causes the mental high, and the CBD does not. To understand what happens to the user when smoking marijuana, it is important to understand how the brain works. The brain contains billions of neurons that communicate via neurotransmitters and are regulated by neuroregulators. Types of neurotransmitters are glutamate and GABA. The endocannabinoid system is one of the most extensive neuroregulatory systems in the brain. It serves as one of the major neuromodulators of the nervous system. When a neuron is activated, it releases neurotransmitters into the synaptic cleft that travels along to bind to a specific receptor on the other side of the synapse. The binding causes a chemical and electrical process that depolarizes the next neuron, creating a domino effect of action potentials. The job of the endocannabinoids is to slow down the neurotransmission to allow the brain to fine-tune communications. This system plays a huge role in the mechanism of action. Marijuana is so effective because it mimics endocannabinoids that the body produces. Endocannabinoids control the production of the neurotransmitters in the brain and relax the muscles, protect tissue, reduce inflammation, regulate appetite, and the metabolism. THC is cultivated from the cannabis and activates the endogenous endocannabinoid system that includes the cannabinoid receptor 1 and cannabinoid receptor 2. THC stimulates the part of your brain that responds to pleasure, like food and sex, and releases a chemical called dopamine, which gives you the euphoric high and relaxed feeling everyone is looking for when they smoke or ingest marijuana. Here is a diagram that gives you a visual aid of the ECS. Now we'll discuss the impact on individuals. If smoked or vaped, THC gets into your bloodstream quickly and gives you your high in seconds or minutes. The marijuana peaks in about 30 minutes. Its effects wear off in about 1 to 3 hours. If you drink or eat marijuana, it takes hours to sober. As explained, common effects are the high, euphoria, relaxation, an altered perception of time, increased appetite, and heightened sensory perception. Adverse effects are fear, distrust, panic, anxiety, and psychotic symptoms, as well as lack of coordination. Marijuana impairs short-term memory, judgment, and distorts perception. It can decrease performance efforts at work and school, as well as making it difficult and dangerous to drive. Marijuana can be addictive and has long-lasting effects on cognitive development. Breathing problems are also reported. One such study, published in Hippocampus Journal, found that teenagers who smoke pot every day for 3 years had abnormally shaped hippocampal regions when they reached their early 20s. Those individuals performed 18% worse in long-term memory tests compared to other test subjects who never smoked marijuana. However, there are good purposes. For medicinal purposes, currently there are 2 FDA medications on the market. They are synthetic cannabinoids used to treat nausea and pain. Other drugs are also in testing that include Epidiolex for childhood seizures, as well as Salvex, which is for cancer pain. Now we'll discuss the impacts on society. If we look at the timeline, the origin of marijuana in the U.S. started in hemp farming in 1600s. In 1952, the Boggs Act passed, creating a strict mandatory punishment for offenses involving marijuana. And then in the 1960s, marijuana gained popularity. In 1965 through 1990s, marijuana arrests were at an all-time high. There was a huge crackdown on distribution and use, as well as the Just Say No and Dare campaigns. The president also declared war on drugs. So this was a time when marijuana was not very popular, or lost its popularity. Public opinion on marijuana has also changed considerably since it became illegal. More and more Americans are becoming pro-legalized. A recent poll revealed that 49% of Americans felt that marijuana should be legal for both medicinal and recreational purposes. Currently, 36 states and Washington, D.C. have fully legalized medical cannabis, and another 14 states allow the use of cannabis products with low THC and high CBD levels for medical use. Recreationally, 16 states and Washington, D.C. have legalized recreational use of marijuana. In summary, I discussed the drug marijuana, its neurobiology, as well as the mechanism of action on both the body and the brain. I discussed the impacts on the individual as well as society. Thank you so much, and I hope you enjoyed my presentation.